try and, oh yes, thank you. I'll try and monitor the chat on their behalf, but we'll also do a Q&A at the end of the session. So let me get to our first slide. It's always exciting to do things on multiple screens, isn't it? So first we're going to be hearing from Dr. April Smith from the Office of Community Standards. So I will hand her the floor.
Awesome. Thank you, Amy. And good afternoon to everyone on this call. For the first year students, as Dr. Jefferson stated, welcome. And for those of you that are returners, welcome. Again, my name is Dr. April Smith. I am the Director of Community Standards. And so our office focuses on student learning through individual growth and accountability. So today, I'm excited to talk with you and kind of give an overview of what we're going to be discussing as we move forward within this presentation. While our nation continues to understand and gain knowledge about the COVID virus, Wingate University is listening closely to the facts of this pandemic and taking time to implement practices for our students, faculty, and staff so that we can return to campus and be able to remain on campus while we're continuing to foster learning and development. So it's an amazing time and an opportunity for us to be able to attend college in person. So I like to see this as a privilege. It is a privilege that we're able to come back on campus because there are many institutions that have opened their doors to students and everyone, and they've had to close their doors because students, faculty, and staff, sometimes we are not following the guidelines that have been put in place. And we want to get back to that normal setting. We want to be able to, not wear the mask all the time, not be in a place where we're having to social distance in such a way. But we can only do that if we take responsibility for our own actions. So it's really up to us. The reality is it's up to us to make that change. And with that being said, ask yourself, how do we do that? So in a few moments, you will hear from various individuals from different departments around campus. They're going to share how we as one dog will keep ourselves healthy and safe during this unprecedented time. So you may be thinking, here we go, more guidelines. Each of us, we're adults, and we believe you will operate with integrity as a Wingate student, faculty, and staff. So why? Because you've already made that commitment prior to your first day of class. If we want to move forward into what we have known as normalcy, we must do our part. So what I like for you all to remember is it's a privilege for us to be able to open our physical campus doors back up so that we can come in and start to fellowship. The more we follow the guidelines, the more we're able to do. So my charge to you is that you will follow the guidelines that are in place, and we'll go through some of those as we go on throughout the afternoon. From my Office of Community Standards, what I want to say is, as long as you are following the guidelines, we can be in a great place. But when some students are not following the guidelines, if you're not social distancing, if you're not wearing your mask, if you are having some type of gathering where you're not following particular rules, then you will come to my office, and there may be consequences where you may not be able to remain on campus. And we don't want that. We want you to have the experience of living on campus. So as we go on, let's look at what things that we can do, and later on ask some questions, and we can go from there. So I'm excited to speak with you and excited for you to hear the rest of this presentation. As you see on the screen, the little piece about Dr. Seuss, and it says, to the world, you may be one person, but to one person, you may be the world. Just think about that. To Wingate University, we are a community. So to us, you are the world. And we want to make sure that we keep our world, our community safe and healthy. So thank you for your time.
Thank you, Dr. Smith. All right, I'm going to page on down. Hang on one second. And next we have Serena Ridenhour from the Health Center for all things COVID introduction and friendly reminders about how things work. Thank you so much.
Thanks, Amy. Good afternoon, everybody. I am Serena Ridenhour. I'm one of the nurse practitioners here on campus at the Wingate Health Center. So I am going to go over this afternoon just some refreshers, some reminders and tips and information about COVID, and also just some policies and practices that we've helped to establish here on campus. Just like April said, with the hopes that we can keep our doors open and everyone can stay here on campus. Amy, you can go to the next slide if that's okay. So just really basic, starting off. By now, we all know, I'm sure, what COVID-19 is, but just a refresher, you know, we all know it's a very contagious respiratory illness. It is a novel virus. What that means is just that we know it's a brand new coronavirus that we've never seen before. There are other coronaviruses that we've been exposed to. I'll just mention that real quickly. For instance, you may have heard of MERS, the Middle Eastern Respiratory Syndrome, and SARS. So those were two previous examples of coronaviruses that we've all heard of. They may not have affected us greatly here in the US, but those are just other examples. You can go to the next one, thanks. Okay, so symptoms of COVID-19. I think this is just important for us to discuss briefly because, you know, from the beginning of this kind of starting, really getting heavy in February and March here in the US, the symptoms of COVID and just the knowledge we've gained about COVID-19 has grown exponentially. Today, compared to, you know, March, we now know that the symptoms of COVID-19 are very broad. They fall in many places across the spectrum. You know, when we first started, it was focused mostly on, you know, cough, fever, shortness of breath as the main telltale symptoms. But now, you know, we've done more research, and over time we know that COVID-19 can act very differently in everyone's body. It just depends on that person's response, their immune system, things like that, as well as other factors. But things like fever, cough, shortness of breath are still there, but we've included other things like nausea, vomiting, diarrhea, sore throat, loss of taste and smell, headaches, muscle aches, body aches. So, you know, this can be quite confusing as we're trying to navigate this, and we get, you know, have different ailments from day to day, allergies. We have pre-existing conditions that we deal with on a daily basis. So it can make it kind of tough to navigate this field of COVID to determine, you know, where our symptoms are coming from and what we need to do about them. Okay, next. All right, so let's talk about how COVID is spread. We know for sure that COVID-19 is mostly spread person to person through our respiratory droplets. What are those? That's just when we're coughing, we're sneezing, and potentially whenever we're talking, we are expelling respiratory droplets as well. The greatest thing we've heard about, I'm sure you all have heard about over and over, is how close you are to other individuals plays a big part in this. It's more easily spread whenever you're in closer contact with people. The CDC has identified that distance as about 6 feet or less is considered more of a high-risk distance for contracting COVID. And again, that next line, yes, COVID is spread by people that don't have symptoms. So that is something new with this virus that we don't often see, but it is not uncommon for people to test positive for COVID-19 and never have any symptoms of COVID. Which again further complicates or makes this a little bit more of an interesting virus to deal with. We do hear a lot about contamination in surfaces, and as you see, this next slide talks about cleaning your hands a lot. You know, that is just best practice for everything from preventing flu, colds, you know, strep throat, but also for COVID. For instance, we know if we sneeze in our hands when we go touch a doorknob without sanitizing our hands or washing our hands first, for instance, that's how it can live on surfaces potentially. So it is very important to continue to have good hand hygiene and work on sanitizing and cleaning. Again, you know, try while y'all are on campus, try hard to not, you know, touching your face frequently, because that can also be one way that you can spread the virus if it's on your hands into your body through those mucous membranes of your eyes, your nose, your mouth, anything like that. And again, we want everyone to be able to stay here. We are excited to be here and be on campus. This is where we want to be. We know this is where you guys want to be. So, you know, we're telling you just ways to protect yourself, not only staying 6 feet apart from each other, washing your hands, not touching your face, just trying hard. We know you're excited to see each other, but it's got to be kind of a balance, you know, with everything so that we can be here. You can go to the next slide, Amy. Thank you. Again, ways to protect yourself. Please wear a mask when you're out in public, when you're on campus, when you're in situations where you cannot socially distance of at least 6 feet from others. You know, this is important. You know, again, this is an area that changed drastically from early on in COVID-19 to where we are now. You know, there were other reasons behind that we weren't initially recommending that everyone wear masks at all time earlier in this virus, in this pandemic. There were issues with PPE and availability of masks in our hospitals and just across the nation and things of that nature that we won't get into. But at this point, you know, the CDC has greatly been advising and recommending that we all wear a mask or a face covering when we're out in public, when we're here on campus and we can't be 6 feet apart. Yes, that mask mostly is protecting other people from your respiratory droplets. So in case you had COVID-19 and you were not aware that you had it, if you were someone that was asymptomatic, but there have also been studies to show that while, you know, the mask or face covering protects others, it does offer protection to you as well from other people that you may be around. So, and again, clean and disinfect like we talked about. Okay, so this slide is really important. You know, talking about how to properly wear your mask. You know, a mask is only as efficient or effective if it's being as correctly as it's being worn, if that makes sense. So if a mask is not being used correctly or worn correctly, it is not going to offer the protection that others would like to have from your respiratory droplets, nor is it going to provide you any protection. So I put up here on the slide a few pictures and examples of the process of what you should do before you put your mask on. Wash your hands first, then get your mask. Be sure not to touch the outside of the mask. That is where a lot of germs and particles, or respiratory droplets, if you've been out in public, can be located on that surface. And make sure, this is the biggest thing, is you see the don'ts on the bottom of that flyer. Make sure that your mask is all the way up over your nose, okay? You want to pinch the top of the nose just like that other picture showed you, and then it should come all the way down below your chin. I think we all see lots of people that will wear masks out in public with the nose hanging out, for instance, and, you know, we all know that they aren't always the most comfortable things in the world, but, you know, again, it's just about making sacrifices and learning to work together and deal with things, and it can be worth it if we can all stay here. So that is something we're really encouraging you guys to do. All right, next. All right, again, these are more things related to, you know, how to operate daily here on campus to protect yourself and protect others. So as you guys probably know, the Health Center has been sending out reminders every morning for you guys to please complete your daily symptom tracker through your health portal through the Health Center's website. So you do have to log in to your Health Center account through that portal with the Health Center, and it directs you to go to the COVID-19 tab and then click on complete your daily symptom tracker. We are asking everyone that is going to be on campus, whether you're on campus 1 day a week, every day of the week, or a few days a week, if you're a commuter, residential, an employee, that you guys and us as well complete this daily symptom tracker, even on the weekends. And that may seem like a lot, but it just takes a second. It's 2 questions, and if anything abnormal comes up, you know, we've provided you guys with directions of what to do next to go ahead and contact us, or even if it's on the weekend, someone from the Health Center is always working to check these abnormal responses with the health tracker. The biggest thing, we want to stay ahead of things, and we want to be able to talk to you and provide you with the best care and direction possible. So please, if you guys ever have questions about that, feel free to call the Health Center. That's what we're here for. The other thing, if you're not sure, you know, what's going on, if it's COVID, if you know what your symptoms are, when all else fails, stay home, stay in your dorm, stay in your apartment, and give us a call, okay? We'd rather you err on the side of caution and then be cleared from us after we have a conversation versus you dread missing class or not getting behind or being afraid of getting in trouble, something like that, and go out and potentially expose other people. Again, cover your cough, cover your sneeze, and then be sure to wash your hands after. Wear your mask, social distance, and just frequently sanitize. And again, just working to being able to stay on campus. Okay, so this may be something that lots of people may care a little bit more about or be interested to see what we have available here on campus. We are performing COVID-19 testing here at the Health Center. We've been able to do that all summer, actually, so that's been a great blessing to have that resource here on our campus. We do offer 2 types of COVID-19 testing. There are viral tests, where that typically, those are the nasal swabs that we are performing to test for active infection. And then there are antibody tests. So the antibody tests are a blood test that look to see if you've been exposed to COVID-19 potentially in the past, and you've got the antibodies to that to prove that infection was present. So these 2 different tests we would discuss with you and come to a determination of what was the best test for you and was appropriate for your situation, your symptoms, depending on what's going on. And we do perform those here out in our parking lot behind the health center. We have a bus set up that is specifically for all COVID-related matters and testing. Typically, we are getting our results in 24 to 72 hours. I will tell you guys that we've been really pleased. We are getting results really most of the time in 1 to 2 days instead of 1 to 3. So that's a great thing. If you guys may hear on the news, how backed up laboratories are and how long it takes to get test results. So we are very, very, very lucky here to be able to have that turnaround time, because it helps us just to manage any active cases just better and more efficiently. And then lastly, that last bullet point there, guys, we should be able to perform rapid COVID testing here at the health center, hopefully this semester. And I say should and hopefully because we do have several machines that we have planned to arrive here to our facility, which is very exciting. But unfortunately, just some delays have happened as a result of testing supplies that have been allocated out to kind of more hotspot areas throughout the country. Things like that just kind of get delayed out of our control. But just so you guys know, that's something that should be coming, and we're very excited to be able to perform COVID testing, hopefully here this semester, that we would get results before you left the office. So that's wonderful. Okay, we can go to the next one. Okay, so this is a big one too. You guys may have heard about, the difference between quarantine and isolation. You may have already known someone in your personal life that has had to do one of these things. So I'm not going to read through that whole handout. Please, that is there. I want you guys to have that. That came directly from the CDC's website, as you can see. But the biggest thing I want you to know about quarantine and isolation, while they seem very similar, and there are distinctive differences between the two. If you are entering an isolation, it's because you have actively been diagnosed with an active COVID infection, or you have symptoms of COVID, and we are testing you and we don't have your results back. That is very different from a quarantine. A quarantine could be because your roommate tested positive for COVID-19. You aren't positive at this point. You don't have any symptoms. So, that would be a different situation where we say that you would need to go into a quarantine. And that can be very confusing. We understand that. So please, we want you guys to feel ease and know that that is our job at the health center, to talk you through that, to explain what's going on, answer any questions, and give you that direction of what is the most appropriate plan of care for you. And just so you guys know, we are working very closely with Res Life, with dining, with campus safety. There's a lot of interdepartmental work going on campus to ensure that you guys are well taken care of, and that we have accommodations and spaces for students to go to that would need to go quarantine or isolate here on campus, and to ensure that you would have plenty of food and meals and supplies like that. And then also just know that here at the health center, we'll be checking on anyone every single day that may need to be in isolation or quarantine. So that is our job. We are dedicated to that, contacting you by phone, by email, by text. We would set that up with each student depending on what worked best. And also, we would be sure to work with your professors and notify them in any situation that if you had an in-person class, we would notify them that you were unable to attend an in-person class until further notice. Now, with all that being said, as you can see this slide, it's about contact tracing. Contact tracing may be something that you're not very familiar with, may have heard a little bit about, but contact tracing is going to be, again, the responsibility of us here at the health center. So in the case that a student or an employee becomes symptomatic and tests positive for COVID-19, contact tracing is going to happen by one of our employees here. It would either be myself, the other nurse practitioner here, or our nurse that works here. We would contact you if you tested positive, and we would interview you and ask you about any of your close contacts that you had. And then from there, we would reach out to those contacts. Again, this is a very busy slide. I apologize for all the words. I wanted to make sure that you guys had this information available, even if you look back at it after this presentation. But just so you guys know, we are following every single recommendation based on the CDC. We check their website daily to ensure that when they've updated something or changed a guideline or recommendation. And we also work very closely with the health department here in Union County to ensure that everything we're doing is best practice, and that we can know and be made aware if we need to be updated on something. Okay. So this last slide here, these are just tidbits I want you guys to know. Some of you guys may be first-year students here living on campus at Wingate, and then some of you may be returners, so this is not new information. But overall, we all know that COVID has brought a lot of change to everyone's world, to the way everything's functioning, and that's no different here at the Health Center. So just some information for you guys to know. For those of y'all that don't know, the Health Center is located in the Holbrook building. That is right across from the main dining hall on campus at the main campus, main entrance off of Highway 74. We're right there on the corner. We are open Monday through Friday, 8 to 4. And we are operating with an appointment-only schedule at this point. So we do not accept walk-ins at this point unless there's an emergency or an extenuating, circumstance. So please, if there's something that, we can help with, don't hesitate to come and ask. But just so you guys know, we are requiring everyone to call to make an appointment. We also offer in-person visits and telemedicine visits. So you may call for an appointment and we may say, hey, that's great, we've got you scheduled. Your visit is going to be a telehealth visit. And in that case, we have HIPAA compliant Zoom that we are using to have those visits. So that's a great option as well. And we do operate like any other doctor's office. I think that is surprising to a lot of people, but we file your insurance for things that we do for you guys here at the health center, just like your doctor's office does. And we can see you for every single type of visit that your normal doctor's office does at home. So well visits, sick visits, physicals. We draw blood and do labs, and we actually can prescribe medicines right here from our office, depending on the medication, or we can call in medicine just like your doctor does. So we just want you guys to have some comfort in knowing that you do have access to care here on campus. And then again, when you come see us, we are asking that you guys social distance and wear your masks when you come in. We're operating just like the rest of campus is. And then one of the last things I want to share with you guys is, if you don't know, we share a building with our counseling center here. They are amazing. Counseling is offered free to our students here on campus. And if you commute, but yes, to our students, it is a free service, but they are only going to be virtual this semester. So anyone that is getting counseling, you're going to have essentially Zoom visits with the counselor. And I provided their email address at the bottom there so that you can email them if anyone wants to reach out and ask and learn more about counseling services. That's about it. And those are just some resources where you guys can go to get some good information, some references on this information.
Thank you, Ms. Ridenhour. We appreciate that and all the work that you and your team are doing in the health center to take care of all of us. We're very grateful for you all. Next, we have Dr. Melissa Nink. She teaches in our math department. She's also our director of Gateway programs, and she's going to chat with us about some expectations from faculty, whether you're in the remote or face-to-face / hybrid environment. Dr. Nink.
Thanks, Amy. So hi, I'm Dr. Nink, and like Amy said, I'm going to talk to you about expectations that we have as faculty members. Oh, the baby's great. Thanks, Amelia. So in the classroom, what we're asking is that students show up with their mask. I understand that things happen, and maybe you forget your mask at home or in your dorm room or whatever. But please do try to remember that before you leave your dorm room. When I leave my house, I always say keys, wallet, cell phone, and nowadays it's become keys, wallet, cell phone, mask. So when you walk out the door, maybe say that to yourself: keys, wallet, cell phone, mask, just so you're aware that you do have that with you. Make sure that you are sitting in the desks that are labeled that you're able to sit in. I know that catching up with friends and wanting to do something else is always more fun, but we do ask that you sit apart like you're supposed to. Don't share things. I think that's one thing that we would ask of you. So if you forget a pencil, like maybe don't ask a friend to borrow a pencil, actually go back to your dorm and get your own one, or sanitize something before you use it. Just try not to share things between you and other students in the classroom. When we do get to go back, we are going to have to split up our students into multiple sections, just because classrooms can't handle that many students all at once. So do be sure that you're attending on your specific day, just so we can keep within the guidelines of how many students are going to be allowed in the classroom. And if you are online during that day, make sure you go to your online session. Also stay engaged. I know it's hard to do that now with all the distractions that we have going on. There's the mask and all these like students not being there, and there's going to be tons of that, but do try to stay engaged, whether that be in person or online. As far as outside the classroom goes, for office hours right now, we've been asked to do all of those virtually. So I know different professors are doing those differently, but make sure that you are doing appointments for office hours. And if you need to talk to us, or let us know beforehand so we can make sure and get that Zoom meeting or Google Meet set up. I don't know of any professor that's not having any online meetings. So when a professor is offering an online meeting, do try to utilize that. We can't be available all the time. So when we block off, let's say an hour for calculus, like that's your time. So do try to take advantage of that. There is going to be a lot on Canvas. So whatever work your professor or instructor is giving you, try to engage in that as much as possible. So discussion boards, those are going to be crucial if you want to get to know your fellow classmates. And that also allows professors to get to know you, right? I'm learning a lot about my students just by reading their discussion boards. And it's not taking the place of in-person for sure, but it's helping bridge that a little bit. Next thing, be responsible for the work that's online. So don't wait till the last minute and try to do your work. There are still due dates, even though this is all online. I can only speak to my classes, but I have everything due every Sunday night at midnight. So you have a week, right, to do work. So don't wait till the last minute. If you do have a synchronous meeting, don't miss that. I don't think it's fair to ask everyone to record every meeting. So just treat it like it was in person. Make sure that you are going to where you need to go. And then also have good hygiene, please. Well, we do hope to be in person. That's the ultimate goal, but we can't do that if we're not all doing our part. So, as far as ethics go, if you're sick, please don't come to class. I think this is, if you're virtual, yeah, that's a little bit different. But even if you're sick virtually, I think that the professor would understand you're sick, right? Take your time and get well rested, and we'll deal with the academic side of that later. But ethically, if you're sick, get yourself better, okay? Don't do other things that are outside the scope of that. If you're sick, get yourself better. Do take this seriously. I think that a lot of students are thinking, I shouldn't say a lot. I know that there are some students who are thinking that, oh, it's all virtual now. It's going to be a easy ride from here to December. It's not. Like, we got to take this very seriously. We're still keeping the academic integrity. You're still going to have work to do. It's going to be a lot. Now, at the same time, we're all going to be patient with each other. Let's make sure that you understand your professors this is the first time we've all done this, just like this is the first time you all have done this. So just be patient, stay informed, keep up with emails, any announcements that your professors are making on Canvas. Make sure you're checking out as much as you can, check your emails as much as you can, and try to keep the excuses from both sides. I'm saying myself as well. I try to keep excuses to a minimum. So the takeaway from all this, I know Amelia was asking about, there's a baby. The takeaway from all this is that we're all human. This is all new to us, and we all have to be patient. And I put these pictures up here because they kind of represent my goal for caring about people the most this semester. So that's my family. I just had a baby. That's why Amelia was asking about that. That's Jonah. So, they're my number one. I'm trying to keep them safe. But then also, this is a picture of my students I took to Topgolf one semester. I really care about the students and all my coworkers and everyone like that. So if we can just all keep in mind that we're all in this together, we're all trying to just make it through. Academics aside, let's just do what we got to do to be as safe as possible.
Thank you, Dr. Nink. We appreciate those remarks on behalf of your department and all the other academic departments at the institution. Next up, we have Ms. Jessica Swearingen from the Ethel K. Smith Library, one of my colleagues. I'm happy to get to work with her. She's going to chat with us about dealing with fake news, navigating online information, COVID-19, conspiracies, rumors, kind of all the things when it comes to news finding associated with the virus.
Thank you, Ms.
Welcome, Ms.
Odom.
Swearingen.
All the things is no pressure at all.
None whatsoever. Librarians can handle it. I have no doubt.
All the things. All right. Hi, everybody. I am Ms. Swearingen, one of your reference and instruction librarians, also a Wingate alum, go Bulldogs. So I'm going to talk to you about trying to find information on COVID-19 if you're searching yourself. So one thing to keep in mind is news outlets. This is where we get our news. That makes sense, right? But there's two major types of news that you're going to find. One of them is reporting, and one of them is analysis. Now, I think that sometimes there is a natural inclination to say reporting, since it is fact-based, it is as objective as possible, that it is better. And in some ways, I can see where you're coming from, but in some ways, that's not necessarily true. They're just different. So if we're thinking about reporting, we're thinking about facts-based information, data-driven information, but sometimes that's not very accessible to the public. So for example, if someone presented me with a bunch of financial data about how the stock market is doing, I would look at them like they have 5 heads, because that doesn't make any sense to me as a layperson. But if I read an article that is an analysis of our current financial state, then that may make more sense to me. I'm relying on someone else who knows a little bit more about the subject to take that raw information and translate it in a way that makes sense to me as just a general audience member. Analyses do invite a little bit more temptation for bias, so we do want to keep that in mind, whereas reporting tends to be a little bit more objective. But that doesn't mean that facts can't be shared initially, that we later have to retract. Good news outlets will correct themselves if there is misinformation, okay? So be sure you look out for that. Ms. Odom, you can go to the next slide. Awesome. So what you see in front of you now is a media bias chart that is certainly not the end-all be-all of all news outlets out there, right? But it does give you a pretty good idea of, in general, scaling news resources from original fact reporting to stuff that is mostly opinion-based or reactions to those facts and those events. And then you can also see political bias as well, because often political bias is the main type of bias that sneaks its way into those analyses. So you can see it kind of almost as like a bell curve thing. Now, this doesn't mean that if you get your news from one or the other, that that's necessarily like bad, stop doing that. But it is something to consider and think about as you are consuming your news, right? I've highlighted the peak of the bell curve there. And again, that's going to be the most neutral as far as political bias and the most objective insofar as like original fact reporting. But if you need those original facts kind of like translated for you in a way that makes sense, you can kind of go down a little bit and you'll see that there's a lot of news sources that will try to translate that raw information in a way that makes sense for you. Ms. Odom, you can go to the next one. So where does that raw information come from? A lot of times news organizations will look to national and international health agencies. The two ones that I want to highlight here are the World Health Organization and the Centers for Disease Control and Prevention. These two are specialized agencies on the international level and the national level that focus on public health. Public health is seen as kind of sociology, kind of medicine, like in a combination that deals with the entire populace, especially as it pertains to preventing disease. So that's what they're all about. And that's what we'd like to do with this whole COVID-19 thing, is present the spread of the disease as much as is humanly possible. So these would be great places to get information about the coronavirus. And if you see news articles that aren't getting their data from these organizations, you may want to evaluate where that data came from and then maybe assess it against what these organizations are putting out. Ms. Odom, you can do the next slide. All right. So other reputable primary sources, as I'm calling them, would be the, what does that stand for? North Carolina Department of Health and Human Services COVID-19 dashboard. Whew, that's a mouthful, isn't it? But that dashboard is going to give you updates on the state level about COVID-19 in particular. There's lots of good raw data there, and probably also updates from the governor, I would assume. I haven't looked at that portion in a while, but it should have that. Also, if you want to look at the national level again, there's the Johns Hopkins University Coronavirus Resource Center. Whew, none of these have short names. Welcome to academia. We don't do short names here. There is a world tracker that you can find, and it'll show you kind of how the coronavirus is spreading versus not spreading, or how it's doing on a world level, and also on a US level. I know that there's quite a few folks who like to use the Johns Hopkins University tracker in particular. Ms. O, you can go to the next one. All right, so you may not have an uncle whose name is Cletus, but I think everybody has an Uncle Cletus in their life. And we love Uncle Cletus, but Uncle Cletus doesn't always have the best information, okay? So you may see some sort of post like this, and you may think about, okay, what's making Uncle Cletus say this? Maybe how do I respond to this person? And if you elect to not engage at all because you are tired, I totally get that, and I think that is a valid choice. But if you want to respond to Uncle Cletus about the Plandemic documentary or the coronavirus being a hoax, how do you verify the information? How do you approach that conversation? Well, I do have a couple of quick resources for you that help with Facebook interactions like this. So the first one is Snopes.com. I enjoy Snopes, and they specifically have a coronavirus collection. Basically what they do is they look specifically on the internet for rumors, misinformation. They seek out conspiracies and urban legends and different stuff like that, and try to fact check and gather as much information as possible to determine whether or not a rumor, a claim, something like that is true, false, mostly true, some sort of mix, something that's like completely unprovable at all. Like, I think if you looked up Mothman, for example, they can't prove his existence or his non-existence. So there you go. A similar organization would be factcheck.org, and like Snopes.com, they also have a coronavirus page that is specifically dedicated to rumors pertaining to the coronavirus. And also in that vein, there is PolitiFact. Now, of course, PolitiFact is going to lean a little bit more on political arguments, but as seems to be the case now, everything is political. So that's another good place to look. To confirm, deny, get a little rundown of the facts behind the situation, I suppose. So that way you kind of have an idea of the validity of some claims that you're seeing on Facebook, Twitter, TikTok, Instagram, wherever you're getting your information, right? You can always try to go back on yourself and verify it. So maybe you want to learn after this presentation how viruses work, how pandemics work, fact checking, misinformation, want to be a librarian, I don't know, anything you want to know, we're here to help you find the answer as much as humanly possible. So the EKS library is home to over 100,000 books in print, 175,000 ebooks, 147 databases, which contain too many articles and periodicals to count, and 5 full-time librarians on staff, and we are happy to assist with any research needs. As I often tell students, it's what I live for, is to help you find the answers to things. So anytime you need help, just let us know.
Thank you, Ms. Swearingen. Next, also housed in the Ethel K. Smith Library is from the Offices of Disability Support Services, Ms. Kristen Wharton.
Hi, everybody. It is so good. I see familiar faces. I see familiar names. And honestly, we've just missed you guys so much. I can't even tell you. New faces. It's also great to see new faces and new names. And I look forward to getting to know you just as well. But gosh, it's nice to see some of our old friends. We just missed you guys a lot. So what I want to do is just kind of make sure that you guys understand 2 different parts of this from our standpoint. So the first one is the Disability Support Services accommodation process exists all year long, every month of the year, every week of the year. We're always looking to help support individuals who are experiencing barriers to their educational situation. And so that doesn't change for us. What does change under COVID is that sometimes new barriers exist that didn't in the past, such as that transition to an online class or that transition, to the types of delivery, that sort of thing. And so we're always just going to work with students in our same process to identify those new barriers and how we can come up with solutions to both common and uncommon accommodation needs. And so that's something that we will continue to do. So please know that if anybody does need disability-related accommodations, there's a really simple, we just call it a 3-step process. You can find our information by going to the wingate.edu mygate page, going to the 3rd column and finding the Disability Support Services link, and just follow that information in there. Or you can always reach out to my colleague Norvell, who I know is here as well. So my colleague Norvell or I at access@wingate.edu, or my email happens to be arc@wingate.edu. So you can always reach out to us as well. Because I can't help myself, and I have to talk about the ARC every time I get a chance to talk to people, and there are a lot of you here, I want to make sure that you guys know that with all of our services, what we're trying to do is to make them accessible to you guys in all the ways that are possible for everyone. So one of the things that we've done in the Academic Resource Center is make everything online. So right now, you guys can still access tutoring, you can still access the Writing Center, supplemental instruction. All of our services still remain online because we want students to be accessing those. So tutoring will begin next week. And for all of those services, they're actually going to have the same login this year. So anybody who may need to do that, it's just wingate.go-redrock.com is how you can go in and sign up for tutoring or for the Writing Center. And so since you guys are here, I just want to make sure I made that plug. Now, the second part of this, Amy, if you don't mind going to the next slide. Thank you so much. Serena has already talked a lot about the university-wide mask policy, so I'm not going to go into great detail about the why. You guys understand the why from having listened to her. But we do also want to say that we understand that there may be exceptions, right? And so if that is a situation and there's a legitimate exception, there is a process for us to review that to see how we can best support your needs. So on that same page that I told you guys about, the wingate.edu MyGate page, if you go there under the Disability Support Services link, at the bottom there is actually a mask exemption process. And there's a process for taking those steps. We will review it, and then we will work to see what we can do to support you. Amy, will you go to the next slide for me, please? The two most reasonable modifications for us, thank you, sorry, by the way. The two most reasonable modifications for that, though, are going to be the one that you guys are aware of. Yes, Camilla, I will type that URL in just 1 second. Reasonable modifications to mask usage are going to be the online education, because that's the safest way that we can guarantee that those droplets aren't coming towards you, right? That we can, that we can maintain everyone's safety. In some cases, a face shield, and we have specific recommendations in the policy from, thank you, from student health in terms of the type of face shield that is best. We have that information, but again, that's going to be part of that exemption process. The last part of masks that I want to mention to you guys is that we, again, understand that masks sometimes can create additional barriers. And so one of the things that we've done is that we do have individuals on campus who may identify and may request accommodations for hearing related conditions or reasons that they need to use lip reading. Some may not. And so in terms of us trying to work with students' needs and in some cases faculty and staff members' needs, we have provided these Clearview masks. You can see my dear colleague Marta wearing one in this photo. And so if students have requested those, they have already been sent to the professors who will be teaching the courses for those individuals. We've also started sharing them across campus with different offices, and so we're still sending those out. If offices need them, they can certainly get in touch with us. We have a limited supply, but we will certainly order more if we need to. But the goal is to make sure that we are reducing barriers wherever we may need to. So just want to make sure that you guys have that information, and let me put this link in here for you. And then I think that I'm all set. Thank you so much, Amy.
Thank you, Ms. Wharton. Are you putting that link in the chat
I am.
to everyone?
Yes, ma'am.
Okay, thank you so much. While she's doing that, we'll segue to our next presenter, Ms. Dee Reich from Campus Rec. And I think she actually is in the McGee Center today, so we'll at least get to see part of it, even if we can't visit it.
That's right. Hi, everybody. So glad you're here today. And just so you know, a lot of us have been working really since March to try and come up with plans and ways to provide you not only a quality educational experience, but a good student experience outside of the classroom as well. We know the McGee Center is a popular place on campus, and we have been inundated with questions about when we're going to open. So on the next slide, you'll see because we're in North Carolina, we are following the governor's executive order for phase 2. So for those of you that are not familiar with phase 2 limits the number of people that can be in a restaurant, and it also has limited the opening of gyms and fitness centers throughout the state. Our hope is that when we move to phase 3, that we're going to be able to open. Currently, phase 2 is in effect until September 11th at 5 p.m. Typically, the governor does make an announcement like 2 or 3 days before. So we're really hoping that shortly after Labor Day, we'll have an idea of whether or not we're going to be able to be open for fitness and recreation. As you know, in-person classes will begin on September 8th. And so if you do have a class that's scheduled in the McGee Center, the building will be accessible and open for you to use. And that includes an activity class. So if you are in a resistance training class, I think there's one at 8 a.m., you will be able to meet and do what you need to do in the weight room. Our hope is that once we can open, we will have a reservation system for you to schedule your time in the McGee Center. We're not going to be able to just open the doors and let people come en masse. So the plan is to have 90-minute increments that you can reserve your 90-minute time throughout the day, and we'll have it all set up in our portal, and I won't get into a lot of details now, but our hope is that we will be able to operate under 50% capacity. So for example, in our weight room, that would be roughly 25 people at 50% capacity. So you would schedule your 90-minute workout time, you'd check in the McGee Center like you normally would, and then at the end of 90 minutes, you would have to exit the facility. Next slide, please. So some of the things we're doing to try and make things as safe as possible, in our weight room, in that bottom right corner, you can kind of see we've moved equipment at least 6 feet apart, and in the cardio areas, we've moved them more like 12 feet apart. And you know, just in the effort to keep everything socially distanced. All equipment should be wiped down before and after use. We will have wipes and spray bottles and paper towels available for you to do that. And you should be using hand sanitizer. We're adding more hand sanitizer in different places in the building, using it, you know, between sets or between, you know, while you're using equipment, you know, and then take, you know, clean your hands between each use. And then finally, for now, the functional room will be closed. There's just too many surfaces for us to sanitize. But once we feel like it's safe enough to open, we will do that. Next slide. So our court spaces, just so you know, I've been on Zoom calls for probably 6 weeks or more with the directors of Campus Rec from across North Carolina. And so we're all dealing with a lot of the same issues. And one of the things that we've all talked about is limiting the number of people on courts. So we won't be able to play full-on pickup basketball initially. So we might be limiting it to 2 people per basket with no pickup play. For indoor soccer, we're not quite sure yet. Based on the square footage, it might be 4 people or 6 people at a time. And the racquetball courts will not be available. There's just not enough social distance space there. The fitness studios and locker rooms, for the fitness studio, really the capacity is only like 6 people when they're doing activity. So, you know, we might have it available for you to do some stretching or something like that on your own, but we won't be holding group fitness classes in the fitness studios. We'll be doing them elsewhere. Locker rooms, you will have accessibility to the locker rooms. You will be able to use showers. We'll have spray bottles for you to spray down the shower after you use it. And we will be cleaning the locker rooms between those 90-minute increments when we're open. Some of the other things that aren't available, we're putting away basically all the soft, porous stuff. So mats, foam rollers, things like that are going to be put away. So we do expect people, if you want a mat, you should bring your own. Wingate Outfitters is selling mats for $7.
Wow.
If we could maybe go back a couple slides. Wingate Outfitters is selling mats for $7 online, and you can purchase it online and then pick it up here in the McGee Center. One more, there we go. We won't be able to do intramural team sports like flag football and indoor soccer and floor hockey, or large population events like dodgeball. Sport club activities for now are suspended until further notice, and I'll be working with each of the clubs to see what plans they can try and put in place to do some activities, but obviously putting social distancing at the forefront. And we will not be able to sell guest passes this semester, so you won't be able to bring a guest from off campus into the McGee Center. Next slide, please. Okay, so what is available? We are holding group fitness classes. We started on Monday night. We're having them on the tennis court. Currently, we've had pretty good participation, and it's actually, our instructors are very excited about it. So classes are being held out on outside, and then we also have virtual classes that are held either on Zoom or Facebook Live. We do encourage you to go to our website, which is campusrec.wingate.edu, and you'll see that on the next slide, and you can register to hold your spot in any of these classes. The tennis courts, we can only, because we're outside, we can only have 25 people max, so that's why it's important for us to have you register. Backyard Bulldogs actually just kicked off this afternoon. We'll be in various places on campus from 4 to 6 on weekdays. We have cornhole, can jam, spike ball. We may be adding some other things for you to just come and check out and use in a grassy area on campus, and then return it. We do have equipment checkout at the rec desk going on from 11 a.m. to 6 p.m. You can pick up equipment to play tennis or disc golf, outdoor soccer balls, footballs, those kinds of things if you're interested in doing some things outside. Personal training service will be offered initially virtually and then in person once we're able to open, and you'll see more information about that next week. Intramural sports, we're looking at playing sports that are naturally socially distanced. So tennis, you know, you're on one side of the court and I'm on the other. Disc golf, potentially sand volleyball with smaller numbers. And then we're looking at doing some virtual gaming stuff. It's very popular across the country, everything from like a 2K and Madden to maybe Rocket League and League of Legends and things like that. Trying to do some trivia nights as well. And then we do have some canoes, and we're working on a plan right now to get them down to the lake and secured and be able to allow people to check those out. Our big thing right now, because you're cooped up and you're getting so much screen time, is to get outside. And get outside, whether you're walking somewhere, running, campus lake, campus woods, the paths that go out to the lake, which more or less follow the disc golf course. Just get outside and get active, do something, get your blood moving a little bit, get some fresh air, and I think it really will help you in the long run. To sign up, this is just a little graphic, and this has all been sent on our social media. We have it on flyers everywhere on how to register for a group fitness class. It's just like shopping at Amazon, where you pick a program, you put it in your cart, and you check out, and then you'll get a confirmation email with your registration. The email system was down on Monday, but it's up as of today, and so you should get a confirmation email. And if you're signing up for a Zoom class, the link will be in that email. And finally, just remember too, once we are able to open, you have to wear your masks in the facility. You'll need your ID card in order to get into the McGee Center. And that we want you to follow social distancing, and you should bring your own water bottle. The drinking fountains right now are not even turned on. My hope is that once we're able to open, we will be able to turn them on, at least the bottle fillers. So you're going to want to have your own water bottle. And then you can see down here for reservations that campusrec.wingate.edu. And that's our portal, and you can reserve your spot for a group fitness class currently, and then when we're able to open, your reservation for your 90-minute time slot to work out and play in the McGee Center. I think that might be my last one.
That was the last one. I'm sorry, my computer tried to give you your a test in your presentation skills, but Miss Reich took it right on in stride. I'm grateful for that. And Ms. Wright did bring up a good point. Like, some of the changes that you've seen in our facilities are either dictated by the health department, the CDC, just a variety of different bodies. And we are grateful for your attention to signage. Everybody is trying so hard to read the signs and the traffic flows and wear their masks. And we are so grateful for your contributive spirit and compliance with all that. We know it's a challenge and a change. And again, to Ms. Wright's point, you'll see some differences. Sometimes she has to say 12 feet and where we might say 6 feet because you're exercising, and in our facility, you might just be studying and sitting. So there are some differences between facilities and buildings. So thanks for paying attention to that. We do have a student. Oh, it looks like Kristen wants to say something.
I do. I just, somebody posted a question privately to me, and I just wanted to go ahead and, I think it was meant for Dee. The question was, will outdoor soccer be played? And so I just wanted to post that to you.
Thanks. Typically we have our intramural outdoor soccer league in the spring. So we're going to remain optimistic that we're going to play. We do have a soccer club that is started on campus last fall, and again, we'll be getting more information out about sport clubs in the next week or so to see if we're able to do anything socially distance, whether it's just conditioning and that kind of thing. Let's see, I have another question. You do not need to make a reservation for tennis. You can check out tennis equipment at the rec desk currently from 11 a.m. to 6 p.m. So just so you know, if you check out rackets and balls, let's say around 5 o'clock, and you know you're not going to be done by 6, you can hold on to that for up to 24 hours. So you can come back and return it the next day. So if, you know, on a hot day like today, maybe you want to play like around 7:30 when it's cooler. And we do have some lighted courts back here. So you can come and return the equipment the next day.
And we did have a student who is going to join us for some feedback. I know she had a class that was overlapping. Courtney, are you here? And if she is bringing her sound on, I did want to say we are going to take just regular questions or comments to anybody on the panel. If anybody had an outline question that we didn't handle. And I know Dr. Jefferson was recording. Mayhap we can get that to the Gateway professors as well, Dr. Nink, if that would be useful. Okay, fantastic. Because it is a lot of information. As Ms. Swearingen said, things are changing on a daily basis, but she gave you a lot of information links to support Ms. Ridenhour's information, and if you have questions. And you've seen a lot of faces and met a lot of people, so when you see us out and about, we're happy to answer any questions you may have. It looks like,
sorry,
yeah, sure.
I have just one comment for everyone. And, you know, I know we've all seen what's happened at ECU and NC State and Chapel Hill, right? And we don't want a repeat of what happened last March, and we don't want to have to do what those schools have done. And so one of the things I want everybody to keep in mind with Labor Day weekend coming up, it's 3 days. I'm imagining a lot of you are going to be going out of town. And so you have to be really, really, really cautious about who you interact with and adhering to those social distancing protocols and wearing your mask and washing your hands and doing all those things, because people are going to leave campus and then everybody's going to come back. And if everybody's been in touch with people from all walks of life in different areas of the state or maybe in the Southeast, you know, we're going to put ourselves at a higher risk for bringing the virus to campus. So I just really want to encourage you to be really careful over that Labor Day weekend and stay safe and protect yourself so that you can protect everybody else.
Well said. Thank you, Ms. Wright.
Amy, I have another question, and I think this may actually be for Antonio,
Okay.
or there may be somebody else in the room who can answer it as well. But the question is do you know if RSOs can meet in person and if they have a size limit?
No, RSOs have to meet via Zoom as well. I think their size, I believe their size limit is 40 or 50. I don't think students don't have the administrative capacity of Zoom, but they do have to meet virtually. And there was some information sent out yesterday. We've had the street fair for the last couple of days, and there was some information sent out with the street fairs, and those are actually recorded as well. So you should be able to log into WooSync and see the recorded street fair from yesterday and the day before, and they provide that information. Or you can email me and I can tell you more.
Antonio, that was really great, the street fair. I logged in just to see what it would be like. And so if anybody didn't participate in that is such an easy way to get information about things that you're interested in. And they're all recorded, and that was just really helpful. So I do hope you guys take advantage of that.
Wonderful. Those are helpful questions in any format. So I don't see any more questions in the chat. And we are grateful. It's a huge crowd, and we are grateful to kick off the Lyceum of the fall 2020 semester. Thank you, Dr. Jefferson. Oh, Dee looks like she's going to say.
There's a student that has a question.
I'm sorry. I apologize. Go ahead.
I was just wondering, one of the, I know that for students that have issues with maybe wearing a mask or something, there was the option to go fully online. But what about students with immunocompromised family members or students who are immunocompromised themselves? Like, how do those work?
If you could reach out to myself or to Norvell Turner privately at access@wingate.edu, or arc@wingate.edu, we will always work individually with students and see what we can do to support you.
Okay, cool.
Yep.
All right, thank y'all for helping me find that raised hand. I appreciate that. Dr. Jefferson, I think we'll just turn it over to you about the LESIM credit follow-up.
All right, sounds good. So everyone hold tight. I'm gonna stop the recording and then I'm gonna put the Google link inside the chat box. And remember to receive credit, you have to fill that out and it should show up in your paths in the next couple days.